Greetings today from SEBHealth's desk. How are we all doing? I guess we're having a wonderful day, a wonderful weekend. Today, I just would like to um, say something about coughing as one of the major symptoms of a form of cancer. You know, some we used to coughing, we used to sneezing and all that, but coughing to some degree, you have to get yourselves checked out. You have to get yourselves checked out. Coughing can be a sign of some kind of cancers that would just be thinking, oh, it's normal cough, we're treating cough and all that. Get yourself checked out, get some tests done. And some of the common cancers that will have coughing associated with them can be lung cancer. Yeah. If you have lung cancer, you can have this persistent coughing, maybe dry coughing, maybe cough with some mucus. But if it becomes persistent, that it's suspicious, you need to get yourself checked out. You might have some chest pain, shortness of breath while you're coughing with that, and you might even cough up blood. Please get yourselves checked out. It might be lung cancer, not just a regular cough. You can have throat cancer, and that can be indicated by persistent coughing as well. You have also have shortness of breath, your voice kind of you have difficulty swallowing something to eat. You eat, but it will be so difficult for you to swallow, and this might change your voice. We have the laryngeal cancer, which also persistent coughing, dry with mucus, with pain. You'll have your voice will change. You can have voice hoarseness or something of that sort. Please, if you are coughing, having chest pain, your voice becoming different, coughing out blood, please get yourself checked, because it can be maybe one of these cancers. It can also be the esophageal cancer, right? Um and advanced esophageal cancers may lead to coughing because they obstruct the airway flow. The air doesn't flow the way it's supposed to be flowing, or irritate the surrounding tissues. And when this happens, you will have some coughing going on. Again, if you suspect anything, just get yourselves checked out. It is really important and advisable to consult a professional, a doctor, somebody of the health, for further evaluation tests done to make sure that it's not just a regular cough. Okay, let's rule out like I said earlier, coughing up blood. You have your sputum has some kind of odor, like it's infected or discolored, or something like that. You feel tired, you have this chest pain, shortness of breath when you're coughing. Please get checked out. Early detection always is advisable. When we detect early, we treat early. When we check, we prevent. And it doesn't get to a stage where we start saying, I wish I knew.